Welcome to another Facebook Live from UC Davis Health. I'm Rick Cushman, and today, because we are a far-reaching healthcare system, we're talking art. We're at the Crocker Art Museum, the beautiful Crocker Art Museum. You can see some of that just behind us. I'm with Dr. Ian Koebner, who directs the Integrative Pain Management Program at UC Davis Division of Pain Medicine. Today, we're going to talk about how Dr. Koebner has used tours of the Crocker to actually help patients with chronic pain. Dr. Koebner, thanks for joining us.
Thank you. It's great to be here.
So before we get into all of that, first question is, do you have a background in art?
I've always been very interested in the arts, and for about 10 years I ran a arts nonprofit that did conflict resolution type work through the arts.
So you've used art as some version of whether therapy or maybe the word is just sort of a door opener.
Yeah, I think that's a great way of talking about it, and you know, really recognizing that it might have value beyond entertainment.
Yeah. So what led you to the Crocker? Was it just loving the place or something in particular?
You know, I got this idea in my head around trying to create socially based interventions for the people that we serve with chronic pain, and was fairly new to Sacramento, but had come to the Crocker a few times, and it's just a stunning place. And in addition to having great physical assets, it's really committed to the community, and so that was enough for me to kind of jumpstart a conversation about whether we could partner with them.
Right. So, by the way, I should mention it's called ArtRx. There are a couple of, if you Google it, you'll find a few other versions of it. So, if you're interested, go to ArtRx and UC Davis. So, tell us a little bit about how the program works and how you set it up, and then we'll talk about your results.
Well, I'd like to think that we set it up collaboratively and iteratively. So, you know, it started with a couple of conversations. The initial conversation was with leadership at UC Davis, suggesting we had this idea to create a program for people with chronic pain to help address this known issue of isolation and social disconnection, and a conversation with the Crocker Art Museum asking whether they would be interested in a pilot partnership with us.
And was the idea, I mean, well, let me just ask it really simply. What made you think, let's get them into this, you know, as opposed to going to a ball game or something like that?
Well, for me, it's definitely not an either-or proposition. It's, you have to start somewhere, and there are a lot of good reasons to start at a museum. Again, the Crocker is committed to serving the community. They have a lot of ongoing programming to bring in non-traditional participants. I think they understand art as experience versus object, so there's a lot of emphasis on your experience of art. But I think that there could be iterations of this program, next steps of this program, that look at the culinary arts, that look at the performing arts, and leave the museum space. But for now, we're definitely committed.
So what happens during an RX tour, or during what do the folks experience, and what happens? Do they get let in? Do they walk around?
Yeah. Well, I think a nice feature, an important feature of the program is, you know, self-identifying as having chronic pain is what is your entry point, your foray into the program. But at that point, pain kind of falls away, and it's not really a focus of the program. So there's a simple registration process. You come, you're oriented to the program. We like to block off one gallery for these specialized tours, so folks aren't having to experience what's called in the literature museum fatigue, you know, where you're going to one floor and the next floor.
Right, you stop looking,
It's really based on a slow art model, where you spend in-depth time with a few pieces of art.
And I imagine, you know, as somebody who loves museums and knows nothing about art, I find that when I just spend a little more time with any one piece, suddenly I'm getting sucked into it. Is that sort of the idea?
I think that's definitely part of the idea, and you're also in a group context, so between the docents and your fellow Art RX participants, you're also getting exposure to a lot of different perspectives and thoughts on the art piece. So not only do you sink deeper into your experience of art, but it's being fed and kind of co-created with everybody else in the group.
Right. And then the docent guides them. So how much does the docent get into it, and what kind of stuff does the docent ask?
I mean, I think the docent is a critical active ingredient in the intervention, because they're kind of the stewards of the program. They're facilitating the discussion, they're encouraging participation, and they have the art history background to kind of drop gems into the conversation in terms of didactics, in terms of maybe the art history of a piece. But the emphasis that the docents put on the program, and an emphasis of the program, is that it's about the person's experience with the art, not the art object itself.
So more like, what do you see? What does it make you feel? That sort of thing?
Yeah.
Yeah, nice. And what types of patients were involved in the initial program? Were they older, younger? What level of pain?
Yeah. So for the initial study, we had a very large age range, from 18 years old to 93.
Wow.
The average age was 59. Everybody, I think it was, everybody who participated in the study self-identified as having chronic pain, so for over a year, and a real variety of diagnoses.
I'm going to talk about chronic pain in just a minute, but let's just stay on this program because this is part of it. So the results were more than fairly positive. They were pretty positive, weren't they?
Yeah, I mean, I think that I'd say they were very positive, but an important feature is that it was the first study to explore this kind of an intervention for individuals with chronic pain, and it was really designed to assess feasibility. If you build it, will they come? Is this the type of partnership that's beneficial for all the stakeholders, individuals with chronic pain, an academic health center, and a major art museum?
Right. Oh, that's an interesting question. It got me thinking about, will they come? So did they volunteer? Did you suggest this? How'd they sign up for it?
You could, let's call it self-refer to the program, or we used what's called a social prescribing method, where healthcare providers could hand out flyers to patients who they thought might be interested. And those were the two kind of main pathways.
So the numbers that you reported that we've had on our Insider and a few other places, this is 57% reported relief. Most of them reported after the tour, and most of them also reported feeling less socially disconnected. Can you talk a little bit about that?
Yeah, I mean, I always like to stress this is an important caveat. This study was not designed to determine causality. That's an exciting set of questions for the next studies. This was really a feasibility study, so really looking, could we even capture this data? Were people coming? And if so, what were their preliminary impressions of the benefit? And we were happy to find that it seemed to be of service to patients in the ways you've mentioned. So people reported pain relief during the tour. They also reported feeling more socially connected or less socially isolated from pre-tour to post-tour. But the next set of studies that we're working on now will start to look at effectiveness, those kind of more exciting questions.
Well, that was my next question. I mean, you look at this place, right? It's so easy to get lost in it. You and I just walking in this morning are going, this was just amazing. You sort of forget yourself.
Yeah.
It's sort of like watching an episode of Game of Thrones. For those of you who watch Game of Thrones, you forget you're in real life. But the effect, how long does it last? And I know you checked in with them afterwards, right?
Yeah, so we did, for the initial feasibility studies, we did pre-post tour and then 3 weeks follow-up. For our next set of studies, we'll probably push that back to a 3-month follow-up. And this question of lasting effect is a really interesting one. We didn't have any expectations that it would have a lasting effect. we tested 3 weeks to see if we could test anything at 3 weeks, meaning methodologically, could we administer the surveys? Did we get responses? We also interviewed people at about 3 weeks follow-up. And through mainly the interviews, some really, for us, interesting findings occurred. So we found that people had a lasting impact in the following regards. This idea that being social was analgesic, was actually of benefit for them, was kind of an educational lasting impact. Then we also found that people...
Well, let's go back to the other, but so what, basically it was a way of them understanding that they could be social, that despite their pain, they could go out and be part of the world. Is that basically what it was?
Yeah, some of the language I was using was that it felt normalizing, unlike walking in for other treatments where you really experience yourself as a patient. To use your language, you lose yourself. Well, I would argue you don't lose yourself, but you do shed certain parts of your identity. You certainly lose the identity of being a patient when you walk through those doors.
Sure.
And reconnect to yourself as a person and potentially a lover of art.
Well, okay, so that was one of the impacts. Now, you were saying?
One woman reported feeling, or rather remembering how much she loved art and how she used to sing and then joined a choir. So, and then I think the most exciting development is we have a cousin program called Artful Meditation at the Crocker Art Museum, where we offer meditation classes in the museum, and I really encourage everybody to do that. It's just so fun. And people have started their own meetup group. So in other words,
see, that's great. So
past participants are taking it on their own to kind of self-organize, come to the Crocker, which was always the intention, right? The Crocker Art Museum, you don't need to book an appointment with a specialist. This is your institution. Come to it, use it. And so that's what people are doing. They're self-organizing, they're coming, they have, and they'll meditate in the galleries, which I just think is a great use of the space and time.
Yeah, nice. It also sounds a little bit like a Woody Allen movie, but... So, was it different for different kinds of people? Did younger people, older people, different kinds of pain people react differently? Was there anything consistent in that?
We don't know, is a basic answer. I think this first set of studies, 2 studies, showed that it was of interest to a wide group of people, which is exciting for us, but wasn't big enough or powered enough to really look at whether it's going to be more or less effective for certain subgroups.
Is that a possibility? You sort of break it down with somebody with certain kinds of pain or certain ages? Or
yeah, I mean, there are a lot of, I think what we did is plant the dot, and now it's going to hopefully provoke a lot of future research and programming questions. But it's conceivable that people who feel more or less socially isolated will benefit more or less, or it might be most appropriate for older, younger patients. But I think what we found from the first study is it's appealing to a wide swath of people who have chronic pain.
Yeah, it sounds like one way to approach it is almost as a behavioral economics study. How do people react to this and how they react to that, and which different group reacts. It's pretty fascinating. So in case you just clicked on this and joining us, we're at the beautiful Crocker Art Museum, if you couldn't tell. And I'm with Dr. Ian Koebner. He directs the Integrative Pain Management Program at UC Davis Health, and has done some studies and has found that bringing patients here for tours has actually helped them a lot. By the way, we will post this on our website, but is that the next tour is on May 11th. We'll try to post a link. We think we can do that. If you can't find it, just go to Crocker website. We'll say this again, the Crocker website, click into the May tours, scroll down, you'll find it. It's called ArtRx. So one of the things that this obviously involves is this sort of notion of getting lost here and being led by a docent. Would this program work if it was a garden tour or a baseball game or going bowling or something like that?
I mean, those are exciting questions, and I hope to have the opportunity to pursue them.
Although I might wonder about bowling, but that's a... I'm not a fan, that's why.
So again, I think what's exciting is that I hope that this program and set of research studies provokes a whole set of complementary programs. For each context, a museum, a reading group, a professional baseball game, there are going to be benefits and limitations.
Sure.
So a good example is, reading groups are great. Book clubs. Of course, there has to be a certain literacy rate for that to be an appealing type intervention. Performing art venues are great. We actually had a wonderful pilot program with the Mondavi Art Center. But we found logistically it can get challenging because you really have to reserve particular seats.
Right.
Whereas here, it's an open, as long as you're not at capacity, you can always invite more people.
Right, you don't have to book row 11. So did any of the groups the folks that came in, did they come back, or did everybody just do it once?
No, we had a lot of people who came back, but they were, you could only be in the study your initial experience.
Right.
But you're always welcome to come back.
So, because I'm wondering if there's, it sort of feels like there'd be like this geometric progression of improvement.
Right.
The more you come, the more you feel, you can feel the place. Did you were able to see if that happened?
So that's another great next step question, which I think what you're pointing to is there a dose response?
Right.
Is more better?
Yeah.
And for this first study, it was just a really quite simple 1-hour program. But in this next set of studies, we're going to start to experiment with a dose response, if you will.
Cool.
And also adding different dimensions to the programming.
So let's talk a little bit about chronic pain. We've seen numbers of 100 million Americans. I mean, that's like, I forgot how many Americans there are, but we're in that 1 in 4 category.
1 in 3, yep.
Could you describe what that encompasses and why it's so prevalent or why it's so hard to treat?
Good question. I think that the most recent numbers are between 100 and 125 million Americans have chronic pain. And, I always like to say, just for some perspective, that's more than those with heart disease, diabetes, and cancer combined.
Wow.
And then we have this related public health crisis of abuse of opioid analgesics.
Right.
One of the challenges of chronic pain as a disease, not a symptom, is that there's no objective marker for it.
Right, that was my next question. It's like, what qualifies?
What is it?
Because I'm a runner, I got a knee thing going on. I'm sure that doesn't qualify, but I mean, what level do you as a medical professional say this is chronic pain?
For me, and I think at this point in the field, the gold standard is if you say it is, it is. That's really important. The narrative is the gold standard for chronic pain. And there are physical examinations and imaging one can do to create a richer view of what's going on. Important for diagnosis, obviously, but really a lot of it comes down to if you say you have it, you have it. And so then there's this tension between the certainty of the patient and the uncertainty of the healthcare provider, and trying to bridge that gap is a real challenge. And chronic pain always has these 3 dynamic pieces to it. They have the biological or physiological component. You said you're a runner, your knee hurts, maybe you have some mild osteoarthritis. But then there's the psychological.
We're not going there.
Okay. Yeah, we won't talk about
we're not admitting to anything like that.
Okay.
No.
Okay. Hypothetically speaking.
Hypothetically, yes.
And then there's a psychological component. There's always a story we tell ourselves about the sensations we're feeling. It's evolutionarily ingrained. It's not about your pathology. So, even if I do something benign like stub my toe, I'm telling myself something about that. I might be telling myself, oh, it's no big deal, or, oh, I'm such an idiot, whatever it is. And then it all happens in a social context.
Sure.
Is that happening in a context of people believing that I have pain? Is it happening in a context of people saying that's all in your head.
Mm-hmm.
Those three dynamics, the biological component, the psychological component, and the social component, are really going to impact how you experience pain.
Sure. So, and you in the study talked about how sometimes pain or the feelings of isolation are exaggerated by, I think the phrase was negative encounters with the healthcare organizations, and of course not UC Davis Health. But, so how does that, is it the patients have difficulty getting healthcare providers to deal with it, or is it the fact that it's so difficult to deal with that it feels like that they're being neglected, or something in between?
I would say all of the above, probably. I think if you try to distill it, there's that dynamic of if you have pain, you are certain you have pain.
Right.
And as soon as you try and express that to someone else,
right.
It can be very well-intentioned space between us, but there's still a level of uncertainty. You don't have that pain, you can't see it. And so that can go really well in terms of feeling heard and taken care of, or it can go really poorly in terms of feeling marginalized, disregarded.
And does that, I would imagine that the longer chronic pain goes untreated, I mean, there's sort of two ways. You sort of learn to live with it because this is just part of your day, but I would think that there's another part of it that would make it worse as time goes on, because will this ever go away? Mm-hmm. I mean, is that part of the problem for chronic pain patients?
I think, one of the potential pitfalls of chronic pain is getting too far in the future, feeling like, wow, if it's this bad today, can you imagine what it's going to be like tomorrow or next month?
Sure.
Now, of course, sometimes it does get worse, and we have to deal with that and manage that. But a lot of times it gets better, and that thinking can become problematic.
Right. So now you got me worrying about my knee for my run tonight. So that's what happens. By any chance we have I know it's a little bit early. We're here early because we're at the Crocker. We want to get out of their way while they do some work. So we may not have any questions. Any questions coming in? Well, this will be up for a while. If you're watching this a little later in the day, you can also post a comment, and we'll try to get you answers. So we talk about all those things, about those feelings of isolation, and now we're back to this notion of a museum. So the Crocker, I think you in your study wrote about how museums are really good partners for this sort of thing, that museums are trying, and we certainly know this about the Crocker, are really trying to be parts of their communities. Was that one of the reasons you chose?
Yeah, absolutely. I mean, particularly public museums, they have, as part of their mission, is to really serve the region. And I think the 21st Century Museum is really trying to push beyond the boundaries of the walls. They're trying to push beyond being warehouses of precious artifacts. And Crocker's, I would say, a national leader in terms of making sure that they do everything in their power to make sure the whole community feels welcome, whether it's through the ArtRx program, Artful Mindfulness program. They have an access committee committed to exploring those issues, Block Initiative, Art Mix, kind of their public programming goes on and on. But it's all part of pushing forward this idea of what a museum can be.
Right. And all that stuff that Dr. Koebner mentioned is on their website. If you go to their events, most of that's in there. It's not hard to find in there. So one last thing. So how different is this from art therapy?
Well, art therapy involves a healthcare professional, an art therapist, providing specialized care. The focus of art therapy usually is around the part of one's identity that has a problem, whether it's the depression or pain. Really, most of the conversation, the vast majority of the conversation taking place in the ArtRx program is about everything other than that. It's about all the other parts of your person that aren't about being a patient.
Right, I see.
And that last part is really important. Art therapy is for patients. ArtRx is for people.
Right, making you feel like you're not a patient.
Yeah, and then I do want to just add one other component is that it's more generalizable,
right.
I think, because we don't ArtRx, and this is one of the things we hope people take the baton with, is it doesn't involve a healthcare specialist. This is in many ways kind of peer-to-peer programming. And there are art museums all around the country, many of which offer kind of free or reduced entrance fees that could replicate this kind of program. It's harder to scale up art therapy.
Right.
And the last caveat I want to point at is that we may incorporate art therapists at some point. It's certainly not an either-or proposition, and art therapy is really important for certain kinds of vulnerable populations, but it is harder to scale up.
Sure. Speaking of scale up, that leads to what is this your next study that you're giving, in essence, instructions on how to set this up? Is that the next paper?
Yeah, well, we have a paper published now called Curating Care in Curator, the Museum Journal, that is intended for healthcare providers and museums interested in kind of the nuts and bolts of this type of programming. I'm also working on the development of an implementation guide so that individuals can kind of do an ArtRx program where they are. And the next set of studies will be on building out the program, have it be a more robust intervention beyond the 1 hour tour.
Oh, interesting. Okay. Once again, the name of the program is ArtRx. I want to thank Dr. Koebner for being here on a Monday morning and for all that information. We really want to thank the Crocker Art Museum. Thank you for letting us be here. The next ArtRx tour is May 11th. We'll post a link. It's on their website. And by the way, if you know someone dealing with chronic brain, tell them about this. Let them know. They can go to the website at the Crocker Art Museum, find a little bit more, and maybe this can help them too. Thanks for joining us.